and a update on the Rhode Island COVID-19 response. And we have members of our whole government here today to provide information on a question-by-question basis. So Lieutenant Governor Matos, along with General Callahan, Dr. Nicole Alexander-Scott, our Senior Advisor on COVID-19, Mark Pappas, Education Commissioner Fonte Green, Department of Business Regulation Director Liz Tanner, and Department of Health Deputy Director Tom McCarthy. So thank you for all your leadership and for being here today to let the the people of Rhode Island know what is happening on the ground. These teams and many others who are not here today have been working to make significant progress on Rhode Island's three main goals right now. One, increasing testing capacity. Two, increasing vaccination capacity. And three, relieve stress on our hospital system and support hospital staffing needs. And we'll talk about all three of those today. A bit of good news right off the bat. Starting Thursday, the drive-through rapid test site at CCRI Warwick will be open 24/7. Appointments for the extended hours will be posted on portalri.gov at around 1 p.m. today. And I think a couple of people who got to me over the weekend saying how efficient that CCRI has been in and out very quickly, the individuals that have spoken to me. So 24/7 at CCRI in Warwick for your test site. A few weeks ago, I stood here and said that despite the increased demand, our goal was to get PCR test turnaround times back to where they are in that 48-hour time frame or less. Today, I can say that PCR results turnaround time is on average just over 2 days. We know that's not yet the case for everyone, but it's good progress. And I want Rhode Islanders to know that our team is going to continue to working until everyone is seeing results within this 24 to 48-hour time frame. Right now, Rhode Island is doing more COVID-19 testing than at any point during the pandemic. I think these numbers speak for themselves. I'll just give you an idea. Last week alone, Rhode Island administered 175,000 tests. Almost the population of Providence. 17% of the state of Rhode Island in 1 week. And when we say that we're number one in the nation for testing for contacts, Rhode Island is testing 2 times more per capita than the number 2 state. 2 times more per capita than the number 2 state. 4 times more per capita than our neighboring state of Massachusetts. Over the last few weeks, we've been able to increase our capacity from 10,000 tests per day to close to 20,000 tests per day, doubling our capacity very quickly. I want to thank the team at the Department of Health, our Rhode Island National Guard, the Rhode Island Emergency Management Agency for getting this work done. Next, I want to talk about at-home rapid tests. Today, I can report that Rhode Island has received another 100,000 at-home rapid tests. We're expecting additional shipments to be coming in soon. And as we said, the majority of these tests will be distributed through our cities and towns, and some will be distributed through our community partners. We just recently received tests. We'll be providing an announcement from our office about how and where Rhode Islanders can access these tests soon. For now, do not call your city or town. We're working closely with them, and we'll be back with them very shortly with more information. In the meantime, I want Rhode Islanders to know that we are hunting down these rapid tests, pursuing every possible avenue to get our hands on more. I made calls last week to CVS. I made calls to one of our providers that's in San Diego. We know that The tests have been difficult on a national basis. Rhode Island is getting far more than its fair share, and we can speak to that through Director Pappas along with Tom McCarthy later in the question Q&A to give you more details. Now I want to talk about vaccination. Rhode Island's vaccination capacity has also increased. Every single week we are bringing more testing and vaccination sites online. A couple of weeks ago there were 45,000 appointments available per week. Now we have 65,000 appointments available. Again, to our vaccination teams, both at the Department of Health and the municipal leaders who have stepped up, I want to say thank you. I would also say on the vaccinations that individuals who have not been vaccinated, they've made up their mind. We need to respect the decision, even though we might not understand the decision. But at a visit at Rhode Island Hospital last week, we were told that somewhere between 50% and 75% of the hospitalizations are unvaccinated. So to our friends that are unvaccinated, a word of caution. Be safe. Take the precautions that you need to be safe. Not only to keep yourself safe, your family safe, but also, as you'll hear, we're going to look at ways that we can reduce the stress on the hospitals. I want to take a moment to talk about boosters. Right now, we're all about boosters. You can see the signs on the highway now. Last week, the CDC approved booster shots for 12 to 15-year-olds after 5 months of completing their first 2 doses. While almost all Rhode Island adults have received at least 1 dose of vaccine, 40% of adults have gotten a booster shot, and 32% of all Rhode Islanders have gotten a booster shot. We've got work to do here. I know a lot of people, including myself, weren't expecting to get another vaccination after the primary series, looking at it more of a precautionary measure back in October when I got my shot. But this isn't a one series and done. To gain maximum protection and keep yourself out of the hospital, booster shots are a must. Next, I want to talk about some of the new developments on hospital staffing. Our team has been digging in on this. Today, I am announcing that we are deploying the Rhode Island National Guard to Butler Hospital as part of an initial strategy and increase capacity and relieve pressure on other hospital emergency departments. This announcement is the result of several weeks of close coordination between my office, the Guard, Department of Health, Rhode Island Emergency Management, and local hospital leadership. Deploying Ring to Butler will enable the hospital to increase its capacity to accept patient transfers, allowing other hospitals to send non-critical care patients to Butler and free up more beds at their facilities. Last week, we announced the mobilization of approximately 180 National Guard members to increase vaccination and testing capacity and provide hospital support. Today, we're expanding that to about 200, and we expect to use approximately 60 Guard members for the Butler Hospital strategy. Again, I want to thank General Callahan and our Rhode Island National Guard for always stepping up when we need them. And I know that the General is continuing to work with our Department of Health and our emergency management to conduct outreach to other hospitals in an effort to coordinate additional support. This is not the only step that we're taking to support hospital staffing. In December, we enabled the Department of Health to issue emergency temporary licenses for certain healthcare professionals, including RNs and CNAs. This allowed all health professional applicants who hold a valid license in another state to work without lag time at a hospital, nursing, urgent, or emergency care facilities in Rhode Island. If you have one of these licenses and are interested, please consider helping out. Since then, we've convened a team with our administration to coordinate a multifaceted strategy to address hospital staffing. Liz Tanner, who is our DBR director, is here today, has been heading that work up, working closely with Department of Health, BHDDH, DLT, Veteran Services, CCRI. I want to thank the President for being engaged there. There's some really fantastic things happening at CCRI. Our office and others have been involved in this conversation about strategies to address the staffing issues in our hospitals. We're putting a plan in place to expand and further expedite emergency temporary licenses for recently graduated nurses. This license allows recent nurse graduates to get immediately into the workforce, giving them 120 days to complete necessary exams while working. To maximize this emergency license process, we've organized and enhanced coordinated strategies between the state, local institutions of higher education, and hospitals to get more recently graduated nurses into Rhode Island hospital settings. The state is working with Rhode Island College, University of Rhode Island, Community College of Rhode Island, Salve Regina, New England Tech, and other institutes of higher education to conduct targeted outreach to recently graduated nurses. This week, we've organized 2 virtual job fairs for these graduates, one for Eleanor Slater Hospital and the Veterans Home on Friday, and another for Lifespan on Thursday. At each job fair, there will be someone there to help graduates fill out the necessary temporary license applications. The key here is to make it accessible and easy. To sign up for Eleanor Slater and Veterans Home Job Fair, visit backtoworkri.com, backtoworkri.com, and click Job Fair at the top. To sign up for the Lifespan session, visit lifespan.org, lifespan.org. Now, this is a starting point. We want to see how this process works, and then we'll be engaging with other hospitals. And while this is happening, the Department of Health and the State Human Resources have been readying their team to process these applications quickly. It's a much more targeted, strategic, and all-hands-on-deck approach. And again, I thank everyone for their work in coming together to make this happen. There are many nurses who just graduated in December and are eager to work. So let's do everything we can to get them to work and address the staffing issues that we're all very much aware of. In addition, we're also working to mobilize senior nursing students from CCRI to begin their clinical rotations earlier than the start of the next semester to provide support when and where it is needed. CCRI is also working closely with hospitals to fulfill their request for enrolled healthcare students to enter the workforce as support staff. Lifespan reached out to CCRI last week, and 66 students have already stepped up. Additionally, we're working with municipalities to execute strategy to engage local emergency medical workers like EMTs to assist hospitals and relieve some staffing pressure. We spoke with them all yesterday. Over the next few days, we'll be getting more feedback from the interested communities to allow our office to connect them directly with the hospitals. Our team also met with health insurance providers and Medicaid to request expedited approvals of hospital discharges and transfer to ensure no one has to be in a hospital bed longer than they need to be, and that they can get into the next phase of care, often in a nursing home, as soon as possible. We're currently operationalizing the strategy which will help relieve stress on the hospital capacity. Before I turn it over to our Lieutenant Governor, I want to add that I've asked the Department of Health team to look into updating hospitalization data similar to how New York, Massachusetts, and New Jersey are currently evaluating that information, meaning tracking hospitalizations that are a direct result of COVID or someone being hospitalized then discovering they have COVID. We'll have more to say about that in the next few weeks. With that, I do want to thank the people in the state of Rhode Island for their efforts. I think that they can be very proud of the state of Rhode Island, leading in many areas, controlling the infections, controlling the hospitalizations because of the high vaccination. And we do encourage more and more efforts in terms of the boosters right now.